Would you like a second opinion on your diagnosis? Please send your analysis and medical history to Visite at qs24.tv, and our Chief of Medicine, Dr. Wiechel, will analyse them for free and anonymous in our new series Ward Round. For more information, visit qs24.tv. I'm so happy that we're starting a new dialogue and that I can give you information to help you live your life. More critical and more conscious in your future, but also answer your questions. It's very important to me that you learn to get a wider and especially deeper view about your sickness and to be able to become more active in caring for yourself, because every phase of the course of a sickness, every preventative measurement for yourself means you are in charge. As a doctor, we can just observe indirectly where and why your body can't bring one thing or another back into the old balance, but you are the one that has to become active. And that's why it is so important to me to give you answers to your questions in this and others episodes of Ward Round. Let me get to our patient today. She is still young, 36, and she wrote that since her early childhood, she's been suffering from multiple sicknesses. It all started with an early accident, after which she had to get root canal treatment for her front teeth, with the idea to keep her set of teeth as a child. However, after a root canal treatment, teeth are not alive anymore. Those teeth are now dead. The front teeth were almost knocked out, but could be kept through the root treatment. However, she also received quite early amalgam fillings. That is a large toxic load for a child. She wasn't even an adult yet when she already got varicose on her legs. She is a young woman today, but for many years she's had mental breakdowns and phases of depression, lethargy, unbelievable fatigue, lack of energy, dizziness, difficulties in concentrating, and always has the feeling to be under constant pressure, even though life gives her the rest that she so desperately needs. For me, it is also important to know if your digestion is affected too. And she describes that she's also feels pressure on the stomach and often has the feeling of being bloated. People describe very often that they have to unbutton their trousers in the evening. Everything is too tight. Recurring pressure and pain. Hardened tissue in the groin area. Eyelid twitching. Pain pulling down the right leg. Mood swings. Lightheadedness. Sometimes a slight trembling, like tremor, shortness of breath. A sensitivity to light, hyperacusis. It is a way of hearing noises, which is a symptom that we should not just accept. She also described that she'd been eating vegan or vegetarian for some time and eats very little meat up to now. For a while, she has abstained from eating grains containing gluten, as well as sugar, eggs, and dairy products. That's what I know regarding the medical history, and that's great. Because the medical history is going back to an age which is as precious and meaningful as the current situation. And we should never try to understand a sickness by just looking at the current situation. We also have to understand why some sicknesses develop slowly over time. She has also sent me some test results, thanks for that. And at first glance, it's obvious that the patient has a lack of vitamin B12. We take in vitamin B12 mainly through meat, but also our bacteria in the bowel can produce vitamin B12 for us. The result for vitamin B12 in this test is shown as a 295 pg per milliliter. If you just look superficially, with 187 to 800 being the standard range, it looks well within the range. That's out of question. The question we have to ask, and should also test, is what we have in our blood reaching the cell sufficiently, because it's the cell that needs vitamin B12. It is one of the most important vitamins for hematosis, a nerve vitamin. B12 is taken in through the stomach lining, and the level of vitamin B12, which in a test result should always be in the upper third, is definitely insufficient at 295. If you want to measure vitamin B12 levels and also want to know what it looks like intercellular, mitochondria, our powerhouses, how much cell capacity they have. And that is not just the cell capacity of the liver, but our organs in general. They need a high level of vitamin B12 and folic acid. Folic acid and methylmalonic acid can increase, and if the methylmalonic acid increases, then we know that there is too little vitamin B12 inside the cells. So this can cause a so-called nitrosative stress on the cellular level. That means there is just a false regulation on the intercellular level. This significantly affects, depending on the dosage and the time, the energy capacity of every single organ. That is an important point that I see instantly. And if we say we learned to eat vegetarian, we do not want to eat meat anymore, for ethical reasons or others, then that can be fine. However, the body is merciless. And the body can't do its tasks for you if you don't supply it with enough nutrition. Vitamin B12 can be easily injected subcutaneously and while the academic medicine prescribes 1,000 micrograms per month, we use vitamin B12 subcutaneous with even up to 5,000 micrograms per week to eventually push the vitamin B12 level up. And in the long run, then be able to get by with 1,000 micrograms per month. In the beginning, I would advise, if you get 1,000 micrograms of vitamin B12, for example, from the company Hevet, that you will inject it 3 times per week in the abdominal wall, and then continue the following weeks with twice a week, then once a week, then in the second month every fortnight, and from the third month once a month. You should later on have it checked again, but only through the methylmalonic acid in the urine. The patient also told us her vitamin D3 level, which is shown as nanograms per milliliter. The standard value is 30 to 100, so 32 is definitely insufficient. Don't forget that when you already suffer from sicknesses, your body has to bundle all the energy in the immune system to somehow coordinate and eliminate contamination. If it's parasitical, bacterial, viral, bacterial, arterial, viral, parasitic, 32 is not enough. So you should try to raise the vitamin D level quite well. You can do this with oil-bearing vitamin D drops, for example, that contain enough vitamin D, for example, 1,000 micrograms. In the beginning, you should take about 10,000 micrograms for 5 or 6 days. Then decrease that to 5,000 and stay at 5,000 for now. We are still in a season in which you can go into the sun, but this will also become less in a few weeks. That depends on our location here in Central Europe and the position of the sun. There are only little times of exposition and intensity that can develop the vitamin D to an active vitamin D. And please make sure that come October, November, after raising the level, you will have it tested again to know how you will get through winter. With the treatment of a sickness, we can never get an instant result. Those are very tedious and continuing processes, but we can definitely see that there is a lack here, which then obviously results in a problem somewhere else. It can't be otherwise. That is one thing. I forgot something. The patient also said in honesty that she smokes about 10 cigarettes per day and also likes to have a beer now and then. We consider these as stimulants, but I want to tell you, if you are already close to the limit of sickness with only 36, then now, at the latest now, you should start to take responsibility for yourself and solve those problems. And by that I especially mean the cigarettes. If you just tried to inform yourself about them, that with every breath you poison your body with hundreds of highly toxic substances, then that is not very caring. And if on the other hand you're expecting to be healthy, which require a forceful rethinking, I made it my duty that I will withdraw some of the commitment to my patients if I see that their willingness is limited. The body is a system that has a very high tolerance and an amazing possibility to do things that are not healthy at all. But please don't underestimate what you have been taking for granted. In the course of 5, 10, 20 years, you want to have a body that carries you through life and with which you will feel 100% at ease. If you keep going like that, this will not work. On top of that, we have more toxic results here. Let's talk about the results of the next test, the chelate test. The chelate test is based on the fact that we inject a chelate, for example DMPS or DMSA, into the patients, and during the time of the injection and afterward, the chelate binds to the heavy and light metals, and that succeeded here. The test was done, and the chelate was bound through the kidneys and then eliminated, and we could also see contamination here, both for the light metals and the heavy metals. It is not important if the chelate bond is high or low. First of all, it is important that there is a contamination. And this heavy metal contamination and aluminium contamination is a load that the body always recognises as foreign. There is no special detoxification system. It has its own detoxification system that it got through evolution and eliminates toxic substances on a daily basis that just appear through our own metabolism and could damage us tomorrow. But there is no special detoxification system for those heavy metals. That means my own detoxification system already has to work in its maximum capacity to be able to eliminate the toxic pressure that is building up chronologically. It works, that's without question. A liver is able to do it, but the heavy metals that our body recognises and wants to eliminate right away prevent it from doing that. And if we do tests that determine these toxic contamination, that is a standard test, a standard analysis that has one of the highest priorities today. And of course, I know what can happen with a patient if the detoxification capacity decreased. So I'm getting to a point where I have to say the body has to store it somewhere. There is a very big space for it, the so-called connective tissue. We also call it matrix or Purkinje Rome, and this connective tissue is not really noticed in medicine, even though it is the area that accounts for almost 60 to 70% in us. This is the area that is used to store those toxins. However, this is also the transit path for everything coming as oxygen from the lungs, going via the arteries, arterioles, capillaries to the cells. All our lymph channels go through there. All our nerves are along this matrix. That means very small clusters of nerves go in certain distances along the matrix to the outer skin. Today we know that they are acupuncture points on which there are certain energy paths in a very specific order, and whenever they get on these paths, there is an information in the matrix. It really is unbelievable how profoundly we classify the acupuncture here, which only has one task. It has to activate the regulation capacity so that as part of this metabolism economy, detoxification, the signalling of the immune system's being activated again, so that the energy can flow or excess energy can be discharged. The matrix is an area, if we only speak about toxins now, that is highly frequented by the organism. That means in the matrix there are many testing opportunities to measure these toxins. There is the oligoscan, and I've done it 100 times, that I've verified the toxin contamination that was visible on first glance by measuring them. This is a very realistic estimation of the balance of our mineral and trace element need. But these toxic loads that the patient is carrying cause an imbalance, not only on the level of our immune system. We know today that aluminium can trigger autoimmune disorders. We know that lead, mercury and silver are strong neurotoxins, and mercury can be transformed into methylmercury. That means, apart from plutonium, methylmercury is the most toxic substance 4, if we limit it to us, human health, that means if the methyl mercury is stored in our body, it is severe and all alarm bells have to be ringing because it is a silent and permanent danger for the humans as a self-regulated system. And just looking at these toxins showed me that they have to be stored. And then there is a second question. What about your individual detoxification capacity? There is an enzyme, glutathione S transferase theta, that can be measured, and with the detoxification capacity of glutathione, of oxidized glutathione, of reduced glutathione, and please never begin a detoxification with chelates before that, because it has to be verified that your liver can discharge the toxins that are stored in the fat on a water base. If this process isn't verified, your body just moves them left to right. Aluminium is a light metal. Aluminium is excreted by the kidney, but also by the brain. That means the blood-brain barrier transfers it, and on the bigger part of our patients with neurodegenerative disease, we can see contamination with these toxic metals. Please, if you put your cell phone close to the ear, you are opening the blood-brain barrier, and also other metals can reach the brain. You should use your cell phone as little as possible and use it with the maximum distance or on speaker and as short as possible. That's about the metals. First, verify your individual detoxification capacity, and at the same time, you have to understand in which way you are discharging these toxic metals. You are weakened on another level because you have dead teeth, and you told me in the letter that your amalgam fillings were removed, but the NICOs, the centre of inflammation on the wisdom teeth, and many other visible inflammations, can be corrected by jaw surgery. And it is time to do this now, because with all the local inflammations that you don't even notice because of the dead tooth, you have another boost of toxins for the body on the bacterial level. And the immune system has to work 24/7 to be able to release that toxic pressure. So inflammation in the area of the teeth and jaw are immediately inflammations of the system. And I would really hope that there were more dentists in the future, because we can see today that a dentist has to treat a lot more than just teeth. They have to notice that a dead tooth is a huge bacterial transmitter and causes dramatic stress for the immune system. So please do that and make sure you have tooth and jaw restoration. There's a book, Illness Caused by Interference Fields in the Trigeminal by Ernesto Adler, a dentist who described these cases over 20 years. Very briefly, with 2 x-rays, and the focus on the detail, what was happening in the teeth and the jaw, and how he treated this for 20 years afterwards. And he really healed them. And it's just a collection of clinical pictures, and I want to recommend it to every dentist because the author is a dentist. Sometimes it is difficult for dentists because we have no expertise in their field, and they might think we want to argue about something we don't know, but that's not true. It's just that every tooth is connected to an organ and a meridian. So these are energetic questions. And a patient which did not have an extraction and still has dead front teeth has a lower energy capacity in her kidney and duodenal bladder. That means, like this, the bladder-kidney meridian can never give the same energetic capacity in this area, which also means you are weakened in your kidney discharge. And I have experienced unbelievable things in 25 years, just thinking about it and worrying about the energy capacity of these interference fields, which we are talking about, whether it is a dead tooth, a scar, a chronic inflammation of your sinuses. With little steps, you have to enable your body again so that it will be available for you tomorrow, so that it will bring all this back into balance. Only the body can do this. Us, as doctors, we can help with those points. We can help with the tooth and jaw surgery. We can make a plan to help the body increase the detoxification capacity. But we are not the ones doing the work. The work is done by your body, and it is doing it. This you can trust 1,000%, and you are doing the work by beginning to leave out, and I really hope so, the cigarettes for good, because it is not worth it. To remove something here and then, refill there, and looking at our life, it is already enough. What we take in as toxic substances through the air every day, and many things we can't see with the naked eye. And of course, it is important, and I can understand you in this case when you speak about the varices from the amalgam fillings. Maybe you have blue eyes, maybe you are a lymphatic type and have weak connective tissue. It doesn't matter, it is a problem of the liver. If you need the varices to compensate for the pressure of these 2,000 litres, with an early contamination of metals of the liver, and the liver is our mother, so to speak, before storing inside the connective tissue, it will store these substances in itself, and as a child, this compensation is low. And with that, the functioning of the liver is decreasing. And just by understanding that the liver is fulfilling 500 tasks for us, then these things are crucial. If, as part of growing up and in your adult life, you possibly have the same pressure as everyone else and have to work in the same way, but already have a lower capacity there. But you should know it's not all problematic. If you understand that you have to take responsibility and are taking the second step, you were also speaking about your bowel. This is the root of the plant, so to speak. Please rule out a leaky gut syndrome. It is again relief for the liver. The permeability of the bowel has to be granted. The immune function has to be granted. Look for one of my colleagues and make it your duty to go twice a month for the next 6 months to a colon cleansing. Get enemas with coffee and with garlic. All the toxins are ending up in the bowel. And you already have a weakened base. The kidney meridian is also going along the bowel. Make sure that there is a good relief. Get rid of parasites, get rid of toxins. There is not enough time now for me to tell you how you combine them. You can do it with a high dosage of chlorella, but you can also do this with zeolite, with Toxaprevent. In general, you would do it before the night, because the liver works at night, 3 to 4 capsules in the evening. And these are all good, precious things that will help you in the future. But you have to understand that it will not be done with a bit of commitment for 2 weeks. That is not possible, but you will succeed When you slowly understand what the body had to do for weeks, months, and maybe even years with only half of its capacity here and 3/4 of capacity there, and still compensated for you. Some of these things have hit it harder. So now it is waiting for your help, and I hope I could help you and other viewers with a few thoughts to get a different way of thinking, because this will be the base of a different way of acting and a different way of treating. So thank you so much for this first question and this interesting report. I'm looking forward to seeing you again next week. And until then, all the best. See you next week.
Liebe Zuschauerinnen und Zuschauer, die vorangegangene Sendung ist eine Indikation für einen ganzheitlichen medizinischen Ansatz und ersetzt nicht den Gang zu einem Arzt Ihres Vertrauens. Besten Dank.